been voted by you Best Cosmetic Surgeon for 9 years, and his team has won Best Aesthetician for 3 of the last 4 years by Press Democrat readers. Call now to book a consultation. Today, Dr. Tom and Karina Lozano, surgical liaison, are going to be talking about facial fat grafting. Welcome.
Thank you. Hello, Michelle. How are you?
I'm doing great.
Great. Hi, Karina. How are you?
Hello. Good. How are you?
Good to have Karina here. Karina is just a regular now on our team. So thank you all again. Always thanking the listeners for checking in with us every Thursday from 12:30 to 1 on KSRO. We appreciate you. And you know that Karina is becoming just a part of our team here on KSRO, like she is a big part of the team at Dr. Tom Cosmetic Surgery. Thank you, Karina. So, Karina, it's so funny when I communicate with Michelle, our program director, about what our show is going to be for the day. It really is a manifestation. And somebody walks into the office that day and we talk about what we're going to be discussing here on KSRO. So today we're going to talk about fat grafting. And I know, Karina, you are our surgical liaison. People may or may not know that you're also our surgical assistant, so you help me in surgery. But you're fielding calls and people are potentially interested in some kind of cosmetic procedure. And recently you said you had a few people calling about, inquiring about fat grafting.
Right.
So tell me a little bit, without telling me their names, what kind of questions were they calling about? Because I can't imagine somebody who maybe doesn't even know about it calling up and saying, hey, I want somebody to put fat in my face.
Yeah, that's not usually the beginning of the conversation. It's more of an investigative work for me.
Okay, so you're digging it out of there.
We're trying to figure out what's the best option. And of course we always start with the fillers or Botox or that kind of route.
Okay.
But if they're like, I don't want that, or they want a surgical route or something else, then we can talk about
facial fat grafting. Okay, so Karina, I know you already referred a couple of patients to listen to this show, so thank you for those patients who are. And then we also had a patient who walked in that we're actually planning on doing an upper eyelid surgery on here in the next couple of weeks. And then she started expressing some of the other cosmetic concerns she has, hollowness under her eyes. Maybe she's noticing the folds between her nose and the side of the mouth that we call the nasolabial folds. And so we then broached the conversation about later on considering doing some facial fat grafting. Karina, you're on social media a lot, and you're watching the trends. In fact, I know because we traveled to Hawaii together with Mary, our lead nurse, as part of the Maui Cosmetic Surgery team. And I see you on social media, like, what is she watching? You're on the videos, you're doing TikTok, you're doing all those things. Have you noticed the trend recently about using fillers in the face?
So, yes and no. I try not to watch those kinds of things on my free time.
You're trying to avoid the influencers, right? Yeah, influencers are kind of going by the wayside, which is kind of nice.
Yeah, I like more of the medical side of it.
Right.
Opinions are always great, but more of what suits you. But I do like I guess if we were to call it a trend, I like the move towards a more natural look. Less of a done look.
Less of a done look.
Yes, more of enhancing a woman's or a male's, if they want to, their own features. So yeah, I do like that.
Right. So what you're describing is, as with anything in life, okay. I've got a few decades on you, Karina, in terms of age, but I've seen it even in my short lifespan, where we see the pendulum swing back and forth, and if you're lucky, you see it swing back and forth a lot of times, which means you live a long time, right? And so, as with everything, for instance, let's just take derrieres, butts, There one time somebody was watching a show, the Desperate Housewives, and the main characters on there were saying how cute their flat butts look.
Right.
And then all of a sudden we swing over and the Kardashians come along and all of a sudden everybody wants their derriere as big as they possibly can make it. And now we're seeing a swing and a pendulum back. So we see the same thing with fillers. Let me first of all say, they're recently on social media, and not necessarily medically, this is more by the populace, if you will. There's been kind of a move away from fillers. They're saying, it's the overfilled look, and all these potential problems with filler. And we've been injecting fillers for a long time, and I will tell you, and I have it in my face, and I will tell you that it's a great treatment as long as you use common sense, you talk to the patients, you try to give them guidance. Fillers can offer you long-term facial rejuvenation, looking great, restoring confidence, and I believe that fillers are now they're being underutilized. They're actually a great tool for enhancing the cosmetics or the aesthetics of the face.
Right.
Nonetheless, we are impacted by the social norms and social media, and so we're seeing a move away from that, and people not only want a more natural look, which I like anyways, that's my preference, is a natural enhancement, but they want to now start to move towards, instead of using fillers, which are made out of hyaluronic acid, which people don't understand is actually a biological component of living things, of collagen and tissue, okay? But they want to get away from that. That's manufactured in the lab, and they're looking for items which can stimulate our own biology. And what do we call those?
The biostimulators?
The biostimulator. Very good. I'm getting you ready. You're taking a class a test or something, so I'm getting you ready for the test. That was a trick question. So you're right. What are the biostimulatory techniques called? Biostimulators. So what that is we're injecting different type of treatments. It can be Sculptra, it can be Radius, calcium hydroxyapatite, it can be Renuva, which is adipose tissue, cadaver adipose tissue, and this helps to stimulate the body. PRP, PRF, which is our blood components, which stimulates our body to recreate itself. In other words, we're stimulating our own biology, hence the name biostimulators. Okay, and we've been performing biostimulator therapy for 2 decades. Okay, we've been doing it for a long time, and it's one of the best biostimulators that you can have. It gives you the best longevity. It's the safest. It gives you reproducible results, and that is using your own
biology. Your biostimulators.
Your biostimulator fat. Okay.
Oh, you're fat.
There you go. Okay.
Well, yes.
I'll give you half credit on that one. You got a full credit on the first question. You only get a half. I did trick you. So we're talking about using your own fat. In fact, we call it in medicine autologous, AUTO, not like a car, but auto like your own. So we're doing autologous fat transfer, and we've been doing that now for 2 decades. I learned that from the late Dr. Mark Berman down in Santa Monica. It's a wonderful treatment for rejuvenating the face, which we'll talk about in a minute. Understand that when we use fat to rejuvenate the face, we are actually transplanting not just fat, but we're transplanting a large number of stem cells that are within our fat. When we look at other therapies where we want to do stem cell therapy, most of the time they find those stem cells from doing limited under local anesthesia, liposuction, taking the patient's own fat. They then process it, and they're able to pull the stem cells out of that fat tissue, okay? That's the gold standard of stimulating our own biology. What are stem cells? Stem cells are cells that don't have necessarily a specific identity, like, oh, I'm a bone cell, or I'm a fat cell, or I'm a muscle cell. Okay, the very basic stem cells then can differentiate into what I'm going to call a cell that will develop into a bone cell, or into a muscle cell, or into a fat cell, or into skin cells. And that's the wonderful excitement and mystery about stem cells, which down the road, who knows what we're going to be able to create in regular medicine with stem cells. So when we take the fat and we inject, for instance, in areas where we don't have enough fat in our face, and we're going to go in those technical aspects in a minute, what happens is we get some immediate volume with that fat, okay? But over time, that swelling goes away, because you always get some surgical swelling, of course. And the thought process was that the fat cells, we would have our own fat cells that we now put from, let's say, my muffin top, and I put it into my cheek. What happens is that our blood vessels in our face grow into the transplanted fat, and the fat survives. Well, that was kind of the old-fashioned theory about what we did, and what I used to tell patients some 20 years ago. Okay. Now what we realize is that we put in the fat cells, and those fat cells may or may not survive, but what they have done is they've created a target, okay, a target signal. Like, okay, I just put in fat, and it makes our own stem cells that are sitting in our face, plus the stem cells that we've transplanted along with the fat from your muffin top, and it says, okay, We want you now to develop into mature fat cells. And so what happens is the fat cells we transplanted may or may not survive, but even if they go away, get resorbed, we stimulated our own stem cells to start to develop our own fat, and therefore we now have volume that's based on us. So that's the concept of fat grafting. Okay, so I got technical right away, and you and I talked a little bit about how we wanted to go with this. So when we look at patients, and a lot of times with some of their concerns, we don't do facelifts, we'll say, you know, Ms. Jones, you should have a facelift if this is your concern, your jowls, your jawline, your neck. Okay. And then many of them will say,
I don't want a facelift.
I don't want a facelift. Right, exactly. I mean, we hear that most of the time. I don't want a facelift, and they will say either they don't like the way that it looks, or they're concerned about the actual surgical aspect of that. The other part of that is that they feel that the cost may be prohibitive for them as well. Okay, so then we'll say we should discuss fat grafting of the face, Karina, and it is less expensive than a facelift, but it also doesn't give you the same dramatic differences, okay? To me, they're dramatic, but from a patient's perspective, it's going to look more natural, and that's what I love about fat grafting. In fact, I've been doing it, as I said, for 2 decades. I lecture on this nationally, and we actually teach, prior to COVID, we used to do surgical workshops teaching doctors how to perform facial fat grafting as well, and it's a wonderful treatment. So now these patients come in, I don't want a facelift. What are some of the areas on the face that they say, I want to see this improved? And they may not know that fat will make it better, but what are those areas of concern?
Usually, it can be the hollowing of the eyes. They can kind of see the tired look.
That's a big area, you know, so they feel tired.
Yeah, and that's kind of, you know, when people look, they're talking to you, they're looking at your eyes. Hopefully, they're looking into your eyes.
Yeah, hopefully, they're looking at your eyes, right?
And then, you know, always the jowls. That's always, for women and men, that's always an area that there's a complaint. And then there's other areas that they don't see that will help. We'll guide them.
You'll guide them. So, okay, so now you're so experienced. You're such a great surgical liaison and surgical assistant. Now that you have gained experience working with us over these years, what areas of the face do they not realize is a result of losing volume in the face?
Yeah, mostly their temples, or even the forehead.
And the forehead.
Yeah,
okay.
They're not really looking
so
at that.
What is the end result? So I'm going to backtrack for a second. It's been, I kind of assumed that, but if you've just started to listen to us, one of the caveats of aging is that our skin can lose elasticity, but it doesn't mean that your skin used to be tight and now you can stretch it across the room, okay? A lot of times our aging is related to loss of volume in our face. That's what happens. Unfortunately, we get it in other areas of our body, but we lose it in our face. So when you say the temple and the brow area, you know, what are they complaining about, and how would fat help that area?
I don't think they necessarily look and say, oh, look at my temples, they look so hollow, and look at them, they're so empty.
Right.
They're kind of looking more around the eye. You know, my eyes are looking tired, or my eyebrows are kind of lower. Those kinds of things. The
brows are sagging and they look tired. I would agree. Although it's interesting, they don't, very rarely do they say, oh, my forehead is bony, and I've lost volume there. We will get people who will complain about their temple area, and they'll say, I look like Skeletor. I know that you and Michelle beforehand, you guys were just talking about the movies, and you were going to go see what movie?
Beetlejuice.
Beetlejuice, okay, and I know that's one of your favorites, right?
I love it so
Michelle
much.
loves it, okay. So
Beetlejuice could definitely use some.
So Beetlejuice, right, exactly. So thank you. So look at poor Michael Keaton. So go ahead and take a look at Beetlejuice when you go and see it. And I don't get anything from plugging it, okay? But you'll see the aging around the eyes, skeletons and skeletor. That's where the temples are hollowed out. And you're absolutely right, Karina. A lot of times in terms of that open-eyed look, what patients see underneath their eyes as being hollow, okay? And it makes them look tired. So by adding fat in that area, recreates what happens when we smile. So if we look straight ahead at the camera or talking to someone or we're just serious, our cheeks tend to descend because they're deflated as we age. And so the light from above hits our cheek and bounces down to the floor. It doesn't brighten up our eyes. When we smile, we naturally bringing our cheeks up, and now the light hits our cheek at a different angle and bounces up into our eyes, and that's why we get a twinkle in our eye when we smile, okay, even though our eyes may squint a little bit when we smile. So that's one of the reasons we add fat underneath the eye area. Okay. The other part that you had mentioned was that their brows, they look tired and their brows have descended. So part of that is looking at the forehead, we lose volume. So as we lose volume in our forehead, our brows drop. And all we have to do is look at you who are in your mid-20s and look at me who's an aging baby boomer, and you got a great face and you don't have a bad face by any means, but if you just look at, and we're going to be on YouTube, by the way, so if you're listening, you can, I'm hoping to have it up and on YouTube by tomorrow evening. You can just look and say, oh yeah, Dr. Tom's forehead, he's got a bony forehead compared to Karina. And what you'll notice is that it's just a fine layer of fat. It's not like you have a bulbous forehead or you look like a Klingon in Star Trek, okay? It's not that kind of forehead, but you just have this nice layer of fat on your forehead. You have daughters, right?
Yeah.
How old are they?
They're 8 and 9.
8 and 9. So you look at them, and they're tiny. I know your daughters are so cute, and they're tiny. But if you look at their face, they just have this beautiful layer of fat that gives them that youthful, healthy look, and that's what we're looking for. Whether you're in your 20s, 30s, 40s, 50s, 60s, 70s, and beyond, we want to look healthy, which makes us translates into younger, more attractive, more vibrant.
Right.
Okay. So as we look at that, we're talking about the different areas that we can put it. So typically we put it in the cheeks, we put it in the forehead, temple areas. I put it actually directly under the eyebrow to lift up the eyes. I love that maneuver. Sometimes somebody's chin may be a little recessed. We can put fat in that area to give them a little bit of a chin, a natural chin implant. There's the area that I call the straw sucking area. What is that area that we call that?
That's the straw sucking, the buckle.
The buckle area. Exactly. See, you got that question right. So you're now at 2.5 out of 3 questions right. I'm keeping score.
I thought we were talking about fat grafting, not not quizzing.
Okay. So the buckle area, where if you're sucking a straw, where that becomes hollowed, and putting fat in that area can give you a healthier, more vibrant, and natural look. Okay. So those are areas that we can put it. All right. So now the patient's thinking about the fact that, okay, you kind of convinced me, Dr. Tom, about this. Fat is great. It stimulates my own biology. It's my own tissue. I'm really kind of digging on this idea, my own body's auto-stimulation, biostimulation. When they talk about that, what's one of the common questions they ask about the fat?
People are really curious with anything. How long? How long are my results going to last?
Good. You answered the 4th question correct. You're at 3.5 out of 4 correct today. You are doing great. And so you're absolutely right. So how long does it last? And I tell patients it lasts 3 to 5 years. Okay, but I'd rather under-promise and over-deliver. I will tell you, when I do my presentations to physicians on how to perform fat grafting, I will show them patients out 9 and 10 years, and they still look better than when they started. They, of course, age. Everybody ages. Even a facelift begins to age after the last stitch goes in, okay? We start aging right away. But they still look better, many of them, than they did before we started. And it's because it's this natural enhancement. So even though I tell patients 3 to 5 years, I really think it lasts 5+ years. So it's one of the best bangs for your dollar cosmetically. Okay, so that's one of the questions. So, and so sometimes, Karina, the patients will say, well, geez, you're going to take fat from one area, can you contour the body? And absolutely, we call it a twofer, right?
2 for 1.
A 2 for 1, a twofer. So what we do is we may get rid of the muffin top or maybe the abdominal fat and taking parts of that and putting it into the face to rejuvenate the face. And so you get a 2 for 1. You get an enhancement of your body as well as enhancement of your face. So now we head into, Michelle has a question.
I have a question. You've talked about different areas on the face. Can this plump up your lips? Can you use fat grafting for that?
Can we use it for lips?
Yeah, I've seen him do that.
Nice.
Okay, good. Okay, so now she's at 4.5 out of 5 questions correct. You're doing great. So So absolutely, as Karina mentioned, we can put fat in the lips and it can help to give a natural enhancement. So remember that fat is more, I'm going to call it more structural or foundation work. It's not fine work. So it's not for fine lines and wrinkles. It's for a generalized improvement. So think about that. We always use the analogy, quit looking at the tree, look at the forest, right? We know, it's the forest, not the tree. That's what fat grafting does.
Right.
Filler, other types of treatments can help more with the individual tree, and we'll use that analogy. So, Karina, now we've talked to the patient. They want to go ahead with the procedure. We do everything under local. And so can you just run us through what is the procedure in terms of doing fat grafting?
Yeah, so initially we start with suctioning or removing the fat, harvesting the fat that we want for the face.
Limited liposuction, okay.
So limited liposuction, we have a fancy tool to help us with that, our lipovage machine.
Our lipovage machine. So the lipovage machine looks like it's hooked up to the cannula, which is our suction tube, and it collects the fat. And it's not a cheesecloth, but it looks like there's a sterile cheesecloth within it, so it will suck out the fluid or the local anesthesia, any body fluid byproducts, and we get concentrated fat with that. Okay, so we collect the concentrated fat.
The concentrated fat, and we're actually collecting it in syringes, and we have in the OR table we have them. We start placing them to decanters, so we leave them upside down.
Okay.
We start collecting the fat in syringes.
Okay. All right, so you said decant, so we live in wine country, so basically you're correct, we put the fat, they're in the syringe, and just like when we clean a chicken and you take the skin and fat off, what does that do in the sink when you're cleaning it off? It floats,
rises,
right?
Yeah,
it rises, it floats. So the fat rises, and then the fluid underneath, we decant that off. Okay, so we get rid of that fluid underneath. Okay, we don't get rid of all that fluid. I'm going to get a little techno-nerdy with the listeners. We actually, in that area is SVT, or stromal vascular fraction, SVF, stromal vascular fraction, and that helps to stimulate our stem cell system as well. So we're talking major gold standard biostimulation here.
Right.
Okay, so we take that fat, and now we've completed harvesting the fat. If the patient says, hey, contour my muffin top away, we've finished that. And then we do various nerve blocks on the face so that they don't feel anything, inject local anesthesia. Now what do we do with that fat?
Now we are going to actually what is that word?
Okay, I'll help you. Go ahead. We're going to be adding the PRP.
Well, we're going to be adding the PRF or PRP that the nurse drew up initially.
Okay.
But we're going to dilute it.
Okay. I'm throwing Karina. It's not fair.
Where are you going?
We kind of review this a little bit. Then I ask her to guess what I'm thinking. So we take the fat, and what we do is we run it through a filter.
There we go.
We run it through a filter. That's what she was looking for. Karina is our bilingual specialist, and you just didn't learn filter in English. So
I didn't.
I didn't give you a break. So we'll keep you 3.5 correct out of 4 questions. Okay. So we run the fat through a filter, and as we do that, we're creating nano fat, and we call it microscopic fat. And what that does is, again, develop more biostimulators to stimulate our stem cell system, so we get an enhanced result. So we do run some of the fat through a filter, to get nano fat.
Yes.
And then we both together had mentioned PRP, platelet-rich plasma, or platelet-rich fibrin, which the nurse draws up the blood, they spin it down, and so now we take the serum, which is high in this platelet-rich environment, and again has fibroblasts, which helps us stimulate fibrin or collagen deposition and so forth, and again, biostimulation. And what do we do with that fluid, with that PRP or PRF?
So we'll inject it into the fat to later on put into the face.
Okay, so we're mixing it with the fat, and we have a female-to-female connector between syringes, and we're mixing that, and then at that point, we start to get ready. You're doing all this on the back table. For those of you who don't know, Karina is like our mad scientist. She and Bridie, who's our other surgical assistant, are doing that. So you're mixing that all up and getting it ready for us, and I've anesthetized the face, getting ready to inject it, and then how do we go through the process of injecting?
So once that prepping processes done, we usually move fairly quickly. We want to make sure that there's not a clot, that it doesn't clot. So within the fat, so we transfer it into very small syringes, 1 mL or TB syringes, and we really help keep track of how much and what we're putting in what areas of the face.
Exactly. So we switch them from these large syringes to tiny syringes, micro syringes with micro cannulas, micro needles, and we inject it. The teams, I'm recording where I'm putting it so that we put equal amounts appropriately on each side. And then when we're done, the patient is completed. They walk out of the hospital, actually out of the office, hospital, out of our office, and then they have swelling for about a week. And after that, they're looking a lot younger and rejuvenated. And I know we have so much more to talk about, but we only have less than a minute to go. So I need to turn the show back over to Michelle.
Yeah, there